Are you wondering if you need genetic testing to find out if you are at a higher risk of breast cancer because your grandmother, your mom, or your sister has had breast cancer? I am Fari Haddad, hematologist and oncologist, and I will be discussing with you today the role of genetics and breast cancer. In fact, if you find out that you are at a higher risk of breast cancer, you have options to reduce this risk by up to 95%. To determine if you are at a higher risk of breast cancer, check for any of those 7 factors. You had breast cancer before the age of 50, you had ovarian cancer, you had breast and ovarian cancer, you have relatives with either breast, ovarian, pancreatic, or prostate cancer, any man in your family had breast cancer, you are of Ashkenazi Jewish ancestry, a family member has BRCA1 or BRCA2 mutation, which is an abnormal gene. If your family's history raises some red flags, or your personal history has you worried, speak to a genetic counselor. A genetic counselor will review your family's medical history, discuss the role of genetics in cancer, and perform a hereditary cancer risk assessment. The genetic counselor may also recommend the genetic testing, which is a simple blood draw. However, genetic counseling is a very personal decision. If you want to know this information, then you need to be ready to do something about it. Finding out you have a genetic mutation means you can help prevent cancer or find it early when your chances for successful treatment are highest. But also, your decision won't just affect you. Your test results could also predict your family member's risk of cancer as well. If you learn that you have a family member with a gene related to breast cancer, such as BRCA1 or BRCA2, don't panic. Most of the breast cancer cases are not genetic. However, if you opt for genetic testing and find out that you have BRCA1 or BRCA2 genetic mutation, which is an abnormal gene, then you have up to 87% risk of developing breast cancer. Then, it is very important that you begin cancer screening early. If you are between 25 and 29 years old, then you should do an annual breast MRI. If you are 30 years and older, then you should do annual mammogram and breast MRI, alternating the mammogram and the breast MRI every 6 months. Preventive surgery to remove the breasts, what we call prophylactic bilateral mastectomy, is another option to reduce your risk of developing breast cancer. It's a more aggressive approach, but reduces your risk of breast cancer by up to 95%, and this is why so many women choose it. I hope you enjoyed this video. Don't forget to like and subscribe for more cancer fighting content, and see you on the next video.